3 o'clock on Tuesday afternoon, November 19th, 2024, and I call this work meeting of the Beltrami County Board of Commissioners to order. And I understand, Calendar, you have a new employee?
Hello,
Hello.
What's your name?
my name is Froylan Mendoza.
When did you start at the jail?
I started October 29th of 2024.
Okay.
And what brings you to Beltrami County?
My wife and I decided, after extensive research into the town, well, it's better for us to move here and build new lives here and make everything better for ourselves.
Awesome. Thank you. Welcome.
Thank you.
And please stay for a long time.
That's what I'm planning to do.
Where did you relocate from?
Well, I was in the Marine Corps, so I relocated from different places, but the most recent was California.
Okay.
Yeah, so it's a lot better here than it is in California. Oh yeah, too many fires, just around the corner too.
Well, wait till January comes around.
He commented about the weather walking over,
Oh yeah,
Mosquitoes pick them up and carry them away in the spring.
right?
it's gonna be an interesting time. I love the humidity. Been in Okinawa, loved it. Now it's gonna be a different ball game here though. The cold here, ooh,
Awesome.
Have you ever driven on ice before?
in South Korea, yes.
Okay.
Yeah, so it's a little tricky. I started sliding, but that's when I said, you know what?
On the lake.
Oh, no, no. That's a little too much for me right now.
Oh, welcome.
Thank you,
Welcome.
thank you.
Thank you. Thanks, Calendra. Any other new employees? Brent, you've got some, okay?
Good afternoon.
Good afternoon.
Originally, I had two new employees to introduce, and then was told that we forgot to introduce one back in January or when she started. So I'll start with our oldest new employee, Caitlin Bergstrom.
Oh.
Caitlin took over Zach's position. A lot of people remember Zach kind of shepherding the whole One Watershed, One Plan stuff. So I'll let Caitlin just say a word if she wants.
Yeah, hi, I'm Caitlin. Yeah, I've been here since March. I replaced Zach, so I'm getting in the swing of everything. So I'm originally from Minneapolis, but I came up here to get my master's and I fell in love and I didn't want to leave, so.
Awesome.
Caitlin's been doing a great job. She,
Aw,
took
thank
over
you.
for the One Watershed, One Plan and for, helping some of my constituents with issues in my district and been a welcome addition. Thank you.
She got thrown into the fire right away.
Yeah, she did.
The next one up is Claire Hansen. Claire took Allie's old position as a conservation technician, doing work with landowner, similar type stuff. I'll let you.
So I grew up in Anoka. I moved to Bemidji in 2012 for my undergrad, stuck around for my master's. Have a background in aquatic biology, a little bit of education, and then worked as a conservationist at Hubbard SWCD previously. So glad to be here and at home.
Welcome.
Thank you.
And our newest one is Rose Moore. And Rose took Megan's position and she is learning all the ins and outs of the office and helping everybody with all their projects and is excited and energetic and is ready to help with everything we need. So we're excited about all of
Yeah,
them. I'll let you-
yeah. I grew up in Northeast Minneapolis and I came up here to Bemidji to finish or to do my undergrad. Once again, I fell in love with this place and I decided I wanted to stay for a little longer. And yeah, I just love working here. It's so fun. I love all my coworkers. They're my friends, so.
Awesome. Congratulations. Thank you. Yeah.
Thanks.
Thank you.
Welcome. Thank you. Any other new employees? Wow, that's the most new employees we've had in a long time. That's awesome.
You must have heard about the comp study.
Yeah. Does anybody have any future work meeting topics that they would like to have?
Mr. Chair?
Yes.
Before we continue, are the mics and audio okay for today's meeting? I know there was some concerns for. Okay, thank you. Thank you, Mr. Chair.
No topics? Okay. Gene, you want to come up and talk to us about Northern Dental Access Center? And welcome. Thanks for coming.
Thank you for letting me. I appreciate this opportunity to provide a brief update about the work of Northern Dental Access Center. Last month, when Amy Bowles presented the results of your community health assessment, the issue of dental access was raised. And it seemed like a great time to reacquaint you with our work. 20 years ago, your predecessors had the foresight and wisdom to champion the idea of creating a safety net dental clinic to serve people who struggle to get access to dental care in the region. Beltrami County invested planning dollars and leadership to plan and develop Northern Dental Access Center, even receiving a national award, which still hangs on your boardroom wall today. Years ago, we provided regular updates to commissioners about our growth and progress, and we've been remiss in the past few years, so I'm grateful for this chance to come back today. I've provided a few slides with a very broad overview of our work, and then I'll be happy to answer any follow-up questions that you might have. First, I'd like to point out the service area noted on the map. Our mission is to provide access to dental care for people in need. In this area alone, there are 100,000 people enrolled in medical assistance in Minnesota Care alone. Those programs have dental benefits for children and adults, but many dental practices are unable to serve them. We welcome those insurances, along with offering an income-based self-pay cash discount program for care. This slide also notes our 4 locations, while Bemidji still remains our primary clinic. The next slide provides an overview. Are you able to? Thank you. Of our rapid growth over the past 16 years. By the end of next month, we will have hosted 30,000 patient visits this year alone. With the recent addition of Park Rapids and Bagley, that number is projected to increase again next year. I also wanted to highlight for you our economic impact for the county, bringing millions of state and federal dollars to the region, along with thousands of families who travel here for care, where they also buy groceries and gas and goods. We employ 50 people with competitive, livable wage jobs and full family health benefits. And over the past 16 years, we've have more than 26,000 patients of record who reside in Beltrami County alone. That final slide highlights our approach to services, which includes the recognitions of the social determinants of health that can often create barriers for people in need. With community health workers on site, a creative approach to patient scheduling, and offering patient support services, we go that extra mile to help patients of all ages. Our commitment has been from the beginning to not compete with the private sector dental community. Rather, we aim to be a welcoming referral source for the patients they are unable to serve. Here in Bemidji, we have 6 to 7 dentists on site every weekday, seeing about 80 patients a day. We're up on Ann Street across from the emergency room. If you don't know where we are, drive by, you'll see the volume of traffic that we have. And while the demand for care continues to grow and we draw people from farther and farther away, we are still accepting new patients. So if you're aware of someone needing care who is unable to access it in the private sector, please have them reach out to us. And I've left some rack cards with Ann here if you would like to take any. Finally, this notes our board of directors. As a nonprofit organization, they are the ultimate stewards of our mission. I've been the executive director for almost 17 years and continue to be humbled by so many community leaders who have shared our commitment to helping people in need. Thanks for listening. Quick overview, I promised, but I'm happy to answer any questions you might have.
Questions for Jean? Yeah, go ahead, Joe.
Yeah, on the first slide, it showed your service area. But at the bottom, it said no geographic boundaries. Can you explain that?
So in general, that's a visual that shows where we're drawing the most from, but we take from all over the state and North Dakota as well, because Minnesota doesn't. There was one exception with Itasca Medical, who IM Care, their county-based purchasing, prior to this year, did not allow their enrollees to cross Itasca County boundaries, but we've finally engaged with a partnership with them too, so people can go anywhere with that insurance.
Thank you. Do your dentists work just for Northern Dental Access Center, or do they work elsewhere?
We have a mix. We have been able to capitalize on the independent contractor model by having people who are already in the private sector who maybe own their own practice work a day or two here and there for us. We have semi-retired or people who have sold their practice because they don't want to be in the business aspect of it, just want to do dentistry. We have a few that have sold their practice 20 years ago and just like to stay in the dentist game. And we're now just getting a couple of new grads out of dental school where they can also get their loan forgiveness program through the National Health Service Corps. So we have 4 or 5 generations of a real diverse mix of dentists, some employees, some independent contractors.
Very good. I know you're blessed with a excellent board of directors as well, which is very important for an executive director. So
Indeed.
you got a good crew there, I know, so.
Thank you for saying that.
Tim?
Yeah, Mr. Chair, thanks, Gene, for providing the update. I do appreciate that. It's kind of curious, if you partner with any of the local tribes or IHS. I know that, Red Lake is, having some difficulties, with a dentist. And a lot of people travel to Cass Lake, to receive their care. It's kind of curious, if you provide any services or any partnerships that may be helpful for some folks that, live up in the northern part of your service area.
Yes, in fact, at our last data dive, over 50% of our patient base are American Indian people from the 3 area tribes, but also from farther away. We don't have any formal partnerships. We do provide overflow contract from Red Lake, so they can refer patients that they are struggling to see or fit in. But patients who are dual enrolled in a tribe as well as medical assistance or Minnesota Care, they can go anywhere they want. And so many go just like the option of something local, but they also receive care in an Indian Health Service clinic. So we see a little both. And White Earth has also helped us with, most recently, get a grant for Indian healthcare. We're one of the few non-Indian organizations that receives the Minnesota Department of Health Indian Healthcare Grant because of the sheer volume of patients that we see. So we work to train our team to be culturally competent and humble and welcome patients of all ethnicities to our clinic.
And follow-up question, Mr. Chair. Do you envision or do you see a need for dentists in the near future?
We always have openings for dentists. There's a shortage, like teachers, like nurses, like bus drivers, it's a shortage across the region. So we always have openings for dentists. Hygienists and dental assistants are also in a short supply in the region. So we almost always have openings.
Okay.
Yeah.
All right. Thank you, Mr. Chair.
Anyone else have a question? Richard?
As I said, at the beginning, when I saw you, here earlier, Gene, I know that dentistry through Prime West and trying to get competent, dentists or situations for these people, not just for preventative care, but for the actual major work, it's very difficult to do. And, I think the more we can help someone when they first start having teeth trouble, the cheaper it is for the county or the city or anyone to do that. And there's more and more because there's less dentists. Some of them are pretty choosy about who they have and who they don't have, and the recognition of insurance is also a problem. So.
We're seeing fewer and fewer. We lost so many small town dentists, especially during COVID. And that's why people are traveling farther and farther.
Right.
And Prime West has said they feel we have reduced emergency room visits for oral health issues. And so overall, it should be cost savings. Back before we started, when the county was motivated to help, they were sending 5,000 patients or more out of the county every year for dental visits. And that was the impetus to get this project started. And so, here we are almost 20 years later with this size and capacity. It's just an incredible statement of how a community coalition can really make things happen. So.
And also the idea that we keep people out of the emergency room has proved to be effective.
Yeah.
Good. Any other questions for Gene? Gene, thank you so much for coming. Appreciate your taking the time.
You're welcome. And please have anyone reach out to us that might need our help. We're happy to be there.
Awesome. Thank you.
Thanks for your time.
Tom, are we gonna have Pat dive right into it, or do you have a little something to start us off with?
Well, I mean, if I go, I'm gonna steal his thunder. So I think I'll restrain myself and,
No, Pat
have the
and
team come up
from
and
Kraus Anderson
share with you,
and
but I'll stand for
Larry from
questions.
Integrity, come on up and share us the moment we've all been waiting for. The bid opening and the GMP.
I don't think we, Steve has a little handout too.
Mr. Chair, are there fireworks?
No, we couldn't afford them.
Oh,
I think I could have though. Yes.
Coached him well.
You did, yeah.
Commissioner Gosvick's been in my ear.
Who says you can't be corrupted? Yeah. Well, good.
Board is yours.
Well, thanks for having us today. So today's a day we've been talking about for quite some time, so. Back on October 22nd, we received all the bids for the jail project to establish our GMP, and good news is the numbers came back very favorable. So as you can see, the attachment that Steve has, we handed out was the overall budget sheet. So we can kind of follow along. So I know the overall project budget was $80 million, and once we got all the numbers back, established it, our GMP amount would be $62,647,616. So, came in. I think some of the contributing factors, the time of year we bid it, there's a lot of work coming up around the state of Minnesota next year, so we want to get out and get those sub bids earlier, so that way people can secure their work for 2025. So I think that's part of the contributing factor, so.
That number compares to the previous worksheet we gave you by about 5.5 million less. So
Yeah.
Really favorable. We're
Yep.
happy, ecstatic to see that actually. So,
More similar to the first spreadsheet that we saw, KA,
yeah,
whatever that was, 8 months ago or more.
Yeah.
You're looking at a culmination too of, what, I think 100 bids on 32 packages, so the coverage was very well. I mean, we originally solicited in excess of 200 contractors, invited them to pre-qual, and just over 100 submitted the pre-qualification. So we got a very high turnout on the ones that actually submitted the pre-qualifications. And of course, some of these packages, you look at detention and precast, there's only so many vendors on that actually work. And I don't know if you can see that as a reflection here. The dollars that are actually staying locally here are pretty doggone good. You're talking 43% Beltrami County here that's staying. And then if you even take it the next step and look at something like precast and detention, I mean, that's $15 million of the 56 million bids, and we're looking more like 60% are staying here that has the availability to. So that is excellent.
Go over to Grand Rapids, that number bumps up to 52%. If you really wanted to do a chart too, put Detroit Lakes, because there is, but that's 84 miles away. So, but because the roofer and ceiling guy, which those bids combined is around 2.4 million. So we kept a lot of dollars, local, well, within close to the region to go back when we could. So
basically Beltrami County, if you wanted to look at
Yeah.
it that way, represents about that 43%, which is extremely good and high. We're really happy to see that.
Yeah, and there was a good solid post-bid pre-qualification or post-qualification. So, all the bids received, we've been active, phone calls, interviews, emails, back and forth with these contractors, just dotting the i's, crossing the t's, making sure that they were fully covered on what their bid is holistically. So
We want to verify responsive low, right? Apparent low on bid day is one thing, but to go through and verify everybody is whole, complete, and responsive. That's the list. That's what we ran with. It is 100% responsive low bids that we plugged into the GMP amendment that's in front of you.
Yeah.
Joe, did you have a question?
Oh, just curious where some of the contractors came from outside of Beltrami County. Just if you could name a few off the top of your head, like the county or the city, like any from Grand Rapids or up the range or.
Wells Precast is Wells, Minnesota. That's southern Minnesota. No one detention is in southern United States, although they use Cornerstone for like some of the truss belt cells that come out of South Dakota.
Detroit Lakes had Herzog Roofing from that, and then Dow Acoustics. Grand Rapids had Casper Construction on the earthwork and TNT for the concrete.
Yeah, asphalt actually as well.
Yeah, Grand Rapids.
So that was good to see.
Dow is Detroit Lakes, Dow
Yep.
Acoustics.
Correct.
Arnquist is out of, they got the flooring.
Anderson
section.
Glass.
They're out of, Alexandria.
Alex. Yeah, Anderson's in Grand Rapids.
Yep.
Duluth Coating, Duluth, so.
Yeah, some Duluth, a couple St. Paul, or one St. Paul, Bender on drywall.
The controls out of Fargo, wired electric. Yeah, so that was kind of a good blend, but all companies we've worked with before in the past and always, there's not, so knock on wood. Not one company on that list that we've ever had a bad experience with, you know, so.
No, they're all qualified. That was the point, right? If we're
Yeah.
qualifying those who can perform and provide good services for the project, so we can have some faith that they're gonna perform and not hold things up as well. So that was a really good list that we had put together, and we're happy with those that did respond.
Thank you.
Any other questions for?
Good time to bring it up, or?
Absolutely, ask that, yeah.
Think, guys, as I was looking at the bid stuff, one thing that struck me was the alternate 3B for changing for the camera system to category 6A cable for the cameras. And wondering if you could give me some reasoning on why that was changed or even recommended for category 6A cable, when I don't believe there's a camera on the market that can do more than gigabit speed as a connector, and the 6A cable is to do 10 gig for 100 meters. So, and know why we would need to spend the extra money for that unless it's like extremely difficult to rerun wiring 30 years from now if we ever wanted to put a different camera in there potentially. I just don't know that really is the best use of money to bump that up to a Cat 6A cabling.
From what I understand, Commissioner, the 6A initially was throughout. We revisited that and said, probably do not need it throughout. So the engineer, electrical engineer at EDI did reduce it 100% to category 6 across the board.
Right.
As we talked it through, we had asked at that time when we did that drop to bid things as an alternate. It was bid 100% at either all 6A or not.
Mm-hmm.
After we had some post-bid follow-up with them, asked, is there a need for maybe something specific like cameras? And there could have been a little confusion when we dropped it 100%. I think his intent was to only drop everything but the cameras. He feels strongly that the cameras do need that. I think to your point, future flexibility, but not knowing the exact camera that you're getting.
Just wondering if it's because I could potentially see it if it was because of where the cameras are being installed, that it would be really difficult for whatever reason to pull a new cable in there if it was needed for, you know, a power over Ethernet application or something, not the speed so much as the power potentially, or if they're doing PTZ cameras where they would need more power potentially.
I believe might have been something to do with distance as well. Would that have played a role?
No.
I mean, this would be a great question for.
Yeah.
The electrical engineer.
Yeah, it just, you know, that Cat 6A is so much more expensive and, you know, for however many cameras are in the jail here, $35,000 to bump up to Cat 6A cable just seems like a waste, because I'm very confident that Cat 6 cable would handle it for the foreseeable future for sure, 20+ years at least.
I think it's worth revisiting that, certainly with the engineer of record, to have him give a little bit more formal.
I don't want to hold up the show on the whole deal, but if that's feasible, that we could revisit that, I would like to do that, see if there's something that could.
I mean, you know, easily incorporate with the GMP, and if it's something you wanted to, you could deduct that.
We could deduct it. Okay.
Right out. I think getting the engineer's opinion on it, because I know there were a lot of emails back and forth in regards to why he wants to see the 6A, so. Yeah,
that'd be interesting to get his logic on that. I've got 30 years in technology experience doing that stuff in low voltage cabling, and so I just really question that part.
I think it was like 85,000 maybe to do the whole, you know, all 6A, and we said, no, there's definitely not a need to do that. But yeah, happy to revisit that, and as Larry said, that's an easy thing that we can just cut that back out again. Follow it up as a, you know, point of business.
Great. but otherwise, I'm very happy with how things came out and you got great bids and did a great job. Thank you.
Tim has a question?
I guess a question for maybe Tom or you, Mr. Chair, is this available to the public?
It is now.
Okay.
Yep.
Just checking.
Yep.
Because people watch the YouTube and they're probably wondering what we're talking about. So I just want to make sure that.
Yeah,
It's
it's
available.
available to the public and we'll make sure that we include this in the minutes as well, so.
Okay. Thank you.
Good. Any other questions for Kraus Anderson and Integrity? Joe?
So those were the contractors you mentioned earlier, not the subcontractors, correct?
They're the subcontractors.
They are.
Yes.
Okay, so we're a little ahead of schedule on awarding the subcontractors.
We have not awarded the subcontracts yet. Not until we get to the official notice of procedure from the county and get our GMP executed, then we will award to the subcontractors. So that's part of forming our agreement. When we went out to bid on the 22nd of October, we had everybody hold their bids for 45 days. That technically those 45 days would be up and, you know, we can't hold those numbers past first week of December. We're hoping for, you know, today, tomorrow, notice to proceed and approval, but
Okay.
certainly need that by the end of the month.
Yeah,
So that we can hold all of those subcontract bids that did come in the door.
okay.
So we can get working on shop drawings, submittals, get material procured, and so we can hit the ground running.
Yeah, so they can actually start ordering their materials that have long lead times and so on. Yep.
We've got contractors
Right
who
away.
want to know, hey, can we pencil in our production slot?
Well-
For certain elements of this, so.
And part of it too is, you know, since the job's, you know, spread out over the course of, 2 years, a lot of this material is not gonna be needed till like a year and a half in, so they have to let their vendors know they're gonna hold their pricing.
Right.
So that was the other key part of that too.
Okay.
One more item for you,
Yep.
just to point out on that spreadsheet, previously, we had identified, and it's still there, a fund, if you will, for the existing jail facility. At that time, it was about 3.5 million, we were applying to it with the favorable bidding, we've upped that to 8.5. We think that for now, that seems to be a comfortable price point until it's vetted out on exactly what to do with that facility. So just wanted to be sure you're aware, that's included right now within the budget. And there's still $267,000 in change remaining to apply wherever to that or contingency, whatever it might be.
And to piggyback on that, the sales tax, it's anticipated you're gonna see, it wasn't part of the 80 million, but there'll be about 2 million of it coming back. And that number was based off of what the contractors included on their bid form, what they have estimated. Now those get tracked actual, but we'll compile, put that together monthly basis, and then about twice a year, the county can apply and get a rebate. So it's projected to 2 million. Could be a little bit more, could be a little bit less, but that's a substantial dollar figure coming back to.
Very.
All right. Hey, guys, really shout out to Kraus Anderson and Integrity. You guys have done a great job and appreciate your keeping this under budget. And I know if you wouldn't have, Craig would have gotten on.
It's not an $80 million project.
That's right.
So thank you very much. We appreciate it.
Yep.
Thank you.
Thanks,
Thank you.
everybody.
Thanks, guys.
Thank you. Glad to be part of it.
Paul Bunyan Drug Task Force update, Commander Hart. Welcome.
Thank you for inviting me back. Good afternoon. Thank you again for having me back. We were here last month, obviously providing an update on the HIDA program. Today I'm gonna give you a quick update on what's going on with the local drug task force, so. Just a real quick overview, for anybody that doesn't understand, the Paul Bunyan Drug Task Force is what's called a Violent Crime Enforcement Team, or a VSET, authorized under Minnesota statute. Our goal is to investigate narcotics, gangs, and associated violent crimes, while traveling, I guess, without restrictions that come with, county lines, city lines, what have you, and work with other VSETs around the state on those crimes, because these organizations are working together and they're affecting large areas of the state. We have oversight from what's called the Violent Crime Coordinating Council down in St. Paul. It's made up of local, state, federal law enforcement, and then prosecutors and 4 citizen members. The Paul Bunyan Drug Task Force has changed a little bit over time, of what member agencies are on. but this is a quick breakdown of what Paul Bunny Drug Task Force looks like today. 9-member agencies. Each agency typically assigns 1 or 2 law enforcement officers to work as agents under me on the drug task force. Then I have oversight. We have an executive board that's made up of the chief law enforcement officers from each of the member agencies that have voting rights. To look at kind of where we're at today, these are some highlights from last quarter. We break things down into seizures and purchases, and that's just really the type of case that we're doing. The only difference between whether we're buying the drugs directly from a suspect or if we're interdicting them maybe as they're being trafficked into Beltrami County. So seizures were up, purchases are down. Again, that's just because we're doing less of those direct sales case last quarter. Fentanyl has continued to be a problem, a large problem. As you can see, that's kind of a trend that both seizures and purchases have been up substantially. Cocaine is down, was down last quarter in the area. Cocaine has been something that's been very cyclical across much of the state, not, you know, just Beltrami County, but it kind of comes in waves and goes away for a while, then comes back. Drug arrest, we're below average. Again, that's not anything that's alarming to me as I look at statistics on a quarterly basis, just because, you know, one quarter guys and gals might be doing some of those longer term investigations to where the following quarter is when a lot of arrests and things happen in some of those cases. Overdoses, I'm happy to report, have been stagnant at least. They haven't gone up as we've seen it in previous years. They did begin to start to go up at the beginning of this year, as they often do in the summer months, but then they plateaued out a little bit. I've talked to you know, my colleagues all throughout the state and the individual that oversees all the VSETs, and there's really not an answer to this right now as to why. It's not a supply thing, I can tell you that, because there's plenty of the drugs out there that are being trafficked and being sold. But I think safer use practices, you know, some treatment programs, diversion programs, maybe some of those things are working. So that's good to see, and hopefully that's something that continues downward.
Mr. Chair. So you mentioned overdoses here, and these are reported, not?
These are reported, and true, and these are what's reported. So there's a lot of overdoses that happen that aren't reported to law enforcement. Again, that goes with safer use practices where people, you know, whether they're using a buddy system or whatever, you know, someone overseeing maybe somebody who is using in case they do experience some of those overdose symptoms, that there's someone there with Narcan and naloxone to help, so.
Okay.
These are our statistics from last quarter. The different drugs and then the prices you see associated with them are the street prices that we get from the Minnesota Bureau of Criminal Apprehension. You know, so we do the calculation based on how many drugs we seize and then what the average street price for those drugs would be. So on your top left, we see just over 8 pounds of methamphetamine having a street value of about $250,000. Last quarter, almost 500 of the fentanyl pills that I believe we spoke about last time. Fentanyl pills are less prominent up here in Beltrami County. For whatever reason, the powder fentanyl is something that we typically see in our cases more often. We see just under 3 pounds of powder fentanyl, $166,000 street value. Psilocybin mushrooms have been something that have been trending back as well. Just kind of an FYI, that's repeatedly we've seen some decent seizures of psilocybin mushrooms in the last few quarters. And cocaine, like I said, it's pretty cyclical, but sometimes we see it some quarters, sometimes we don't. These are seizures compared to the same time last year. Again, this is a snapshot. It's not saying, you know, things are completely off kilter, off balance, but we were a lot busier, this year than we were last year, that's for sure. Arrest, again, our arrests were up. What we really look for is in Minnesota, there's a 1st degree through a 5th degree as far as range of controlled substance crimes, with the most severe being a 1st degree. So those 1st degrees and the federal, conspiracy charges, those are the cases that we like to focus on. Those are, the people most responsible for bringing larger amounts into the communities. These aren't your users. They may be users on top of it, but they're responsible for a lot of the drugs being distributed in our county. Last month, like I said, Captain Klesick and I were here providing an update on the HIDA program. These are some of the graphs that I included in there, just about the trends that we included in that petition, showing the increase in seizures we've seen in our area and the problem that we're having. So this is heroin and fentanyl, the spike we've seen dating back to 2017. And then the same thing with methamphetamine, the dramatic seizure we've seen in methamphetamine seizures in recent years. We also track, if we're placing children on holds when we're doing search warrants, that kind of thing. And then obviously firearms that we're taking off the streets. Those are key, obviously, performance measures that are important to show and to highlight. These are some case highlights, just to show some pictures maybe of what, some of these substances look like. This is that about 2-pound seizure of fentanyl. Again, this wasn't directly in our area, but this was an individual responsible for fentanyl being distributed in our area. This was a stash spot. It was a fake battery compartment used in a motor vehicle. People often use hides like this, so interdicting and finding some of this stuff often can be a little bit challenging, but I hope, your battery box under your hood is not tied down with a bungee strap, so that's kind of a giveaway. There in the middle again, that's the psilocybin mushrooms that we saw this quarter. Return on investment, so something I do every quarter when I'm presenting or conducting my update to my executive board is our return on investment. It's good to show, that we're using money wisely, and all the money given to us to do what we do is having an impact. So for last quarter, for every dollar awarded to the drug task force, we had a return on investment of about $5.19. And then specifically, I just wanted to talk to you today about obviously the work that's being done in Beltrami County. We have one agent from Beltrami County that's assigned to the drug task force. Like I said, most people have one. There's multiple agencies that have 2 agents assigned to the drug task force, including Cass Lake and the White Earth Indian Reservation and the Cass County Sheriff's Office. With the increases we've seen, it's a lot of work. Bemidji has become, that central hub, which is why we got this HIDA designation. A lot of stuff is coming here first and then going outwards. And a lot of the stats, the major stats that we see are coming from the Beltrami agent, the Bemidji agent in their cases. So what I do at the end of every year is do an agent appraisal, and I look at, the agent's work throughout the year and how they're stacking up across the task force as a whole. These stats right here in the blue are the seizures made last year by the Beltrami agent, and the orange is the agent median across the rest of the task force. Just blowing those numbers out of the water. It almost is the exact same for the Bemidji agent. Again, case initiation, the Beltrami agent initiated almost 25% of the cases on the Public and Drug Task Force last year, which shows you the amount of work, obviously, that agent is doing, but the amount of work that's out there for that agent to do. So Thank you. I don't, you guys have any questions of me?
Questions today? Thanks for coming.
Thank you.
Thanks for coming back.
Yep.
Appreciate it. Brett, I thought maybe you were gonna make Caitlin do this.
I'll make her do the next one.
All right, one watershed, one plan for the upper and lower Red Lake update.
Do you want me to do that one first, or do you want me to do the
No, we got
cannabis?
Cannabis next.
Oh, I'm sorry, we got the cannabis first, I'm sorry. All right.
I'll do either one at your pleasure.
No, no.
All right, we are here today, first of all, I'm Brent Root, Environmental Services Director. Two reasons. One, to give you an update, kind of, what the draft cannabis ordinance includes, and also to ask you to schedule a public hearing for that cannabis ordinance at your next county board meeting on December 3rd. There's in your resolution or your consent agenda, there's an item in there for scheduling that public hearing. So I'll start out with kind of where we're at. Just quick kind of background. The Minnesota legislature legalized cannabis use and sales, kind of forced local governments into registering businesses and allowed them to create rules. And then the more we move into this, the more we learn, the more we realize that, yeah, that's probably a good idea. OCM is the new government agency in the state of Minnesota, Office of Cannabis Management. You'll see that and hear about that a little bit. The right side just kind of highlighted that OCM has been working on administrative rules. They just kind of completed, but not really completed, but they pushed them out in September of 2024. And they're still working on updating them and tweaking them as they have questions that they can't answer. And they're going through the administrative rule process, the rulemaking process, and they're hoping to have all the rules finalized next summer. Businesses are able to, by law, start being issued licenses on January 1st. What we're being told by our policy analysts at AMC is that that's likely not going to happen January 1st. They're not going to be ready. They're still trying to staff up and do everything. So one of the best analogy I've been told is that we're going down the highway at 70 miles an hour, learning how to drive, and somebody just ahead of us is still building the road. So that's kind of what we're doing here. It's not normal, but that's the process we're in. Just some quick timeline. June of 24 is when we really started doing this, talking about this at the county level. We talked about this with the county board, discussed a possibility of a moratorium ordinance and what local implementation could potentially look like. July, you held a public hearing, adopted a moratorium ordinance. That moratorium goes through January 1st. August, the county board provided some guidance and recommendations to the Environmental Service Department Planning Commission for that ordinance. October, the Environmental Service Department Planning Commission completed work on the draft ordinance. The Planning Commission held a public hearing last week, November 13th, on this cannabis ordinance. And then that night they made one minor edit, and then they voted to recommend approval to the county board. So on the right side of the screen, the highlighted part, that's where we're at today. That's county board presentation here. And next steps would be public hearing next week or next board meeting if you are agreeable to that, and then adopting an ordinance prior to January 1st, either at that first meeting in December or the second meeting in December would be still time. It could be adopted after January 1st. It's just the moratorium ordinance expires January 1st. So the kind of some background information before we get into details of the ordinance itself. This is confusing for most people when we talk about this, so I'll keep trying to say this, but cannabis retail businesses have to register with the local government where it's located before they can start sales. Cities and towns can delegate the registration authority to the county. They're not required to, but they can. Local governments don't register the non-retail businesses. So like cultivating and manufacturing, those don't get registered. The state of Minnesota Office of Cannabis Management licenses all these businesses. So they'll have a state license. And then if they're doing retail sales, they'd be registered at the local government level. And that's kind of it. So now we're going to get into the ordinance draft language, the summary.
Brent, you might want to mention that the order of operations, or maybe you'll get to it, about that they have to apply for the license first and then
Sure.
come to us to get registered and
Yeah,
and
I can
approved.
do that right now. Thank you.
Yep.
Yeah, right now, the state of Minnesota is in the process of vetting this pre-application period where applicants of social equity were allowed to apply to the state for licenses ahead of the general public. They're through the majority of pre-vetting is what I've been told, but there's still a lot to do. And then they'll be hopefully holding a lottery for those licenses. And then after that, the general public can apply. So they can't come to the county and ask for registration until they've been issued a state license. The state will issue a preemptive or preliminary license based on getting local registration approval, which includes zoning approval. That kind of sums it up, hopefully. So then at the registration level, these are registration requests are going to be coming electronically to the county. The county auditor's office in our ordinance would be in charge of that registration process. And I envision it would be similar to the liquor license, tobacco license registration that the county auditor's office does. I know the process is a little bit different. I've been talking to Leela Roth in our auditor's office who does that work. So she's been talking to OCM and is kind of figuring that how that's going to look and how that's going to work out already. The county sheriff's office would be required to complete the mandatory compliance checks of the registered retail businesses. I apologize to the sheriff's office, but this is required whether we have an ordinance or not. The state says this is what's going to happen. And then Environmental Services Department and the Planning Commission would review conditional use permit applications for specific business requests. And that's mostly from like a zoning perspective. In the ordinance, it says the county will limit the number of businesses to one for every 12,500 residents. That means we would have a maximum of 4 in the area of the county where the county ordinance would apply. Cities and townships can choose to adopt their own rules, and they can choose to have unlimited numbers. They can choose to have different numbers. They do not have to be as restrictive as the county. This is kind of a backwards rulemaking where most of the times county sets the standard and then cities and towns have to be at least as restrictive. This one, the statute is written a little bit differently where cities are given their own kind of unique path of administering this, and townships, that one is still kind of undetermined or undecided as far as rules and guidance goes. The other thing I just learned recently today, this morning, was that the tribal compacts and the tribal agreements are being worked on at the state level. But right now in the draft rules, it does say that those business licenses can count towards our maximum number if we decide to have them count towards our maximum number. Next, hours of operation, the Planning Commission determined would be 10 a.m. to 10 p.m. And advertising signs, they'd be allowed 2 total, not to exceed 100 square feet combined. Here's a summary of the buffers. So in state statute, they allow counties to limit where these retail businesses could be located. And these are the maximum distances that statute allows. So that's what's in our draft ordinance now. And it was an interesting scenario where the city of Kelliher came to the Planning Commission and presented information that their city council has a business. Yep, sorry, my bad. The city of Black Duck has identified a downtown business district that is within 1,000 feet of their school. And that is a place where they wouldn't mind seeing a cannabis business go if somebody wanted to put one there. So we added language in our draft ordinance that allows cities and towns that have delegated authority to the county, essentially the power to grant variances to these buffers. They would have to do it at their council meeting or town board meeting and vote on it. And then we would get their minutes and we would have the official, here's what they approved. And so we could go less than that. There is no other process other than that. Kind of a zoning summary. So these are the different activity types: cultivation, manufacturing, wholesale, transportation, delivery, and retail. And they're all a conditional use permit in the non-shoreline zone. And retail is the only one here that would be allowed in the shoreline zone as a conditional use permit. And so the conditional use permit, the whole reason that counties issue conditional use permits is so that the county has the ability to review the application on a case-by-case basis, look at the business proposal, look at the area that it's gonna be going in, and then approve that application with appropriate conditions. So it's called a conditional use permit. So whether it's off-street parking or lighting or security or noise or odor limits or things like that, that's what the planning commission then would just initiate in with the conditions and the conditional use permit. Temporary cannabis events is another kind of category that's in state statute. Kind of unique how it's worded and written. It just says, our ordinance says a permit would be required for that. That permit would be issued by the auditor's office, similar to their actual registration. And then I just added in here for clarity that they would be required to get a conditional use permit for certain events if it reached over 1,000 people, because if it reached over 1,000 people, our county public gathering ordinance would then apply. And that requires a conditional use permit. So whether it's a temporary cannabis event or not. In there, it specifically says they can't apply to host one of these events on county-owned or city-owned property in those places that have delegated their authority to the county. So they'd be doing it on private property. And then the next thing isn't related to temporary events, but low potency, we've kind of had some confusion or uncertainty there. I've clarified some of that stuff today, but it would be a conditional use permit. It's essentially retail sales. So it'd be a conditional use permit in non-shoreline and shoreline. It'd be allowed in municipal liquor stores without a conditional use permit. It's just allowed flat out. And then it doesn't count towards our 1 to 12,500 people. Those are the low potency retail sales. And our auditor's office has looked up the ones that are licensed right now by the state of Minnesota for low potency sales. And I don't remember the exact number, but it's in the low 20s range in Beltrami County that are licensed to sell low potency stuff right now. And that is my fast summary of a 13-page draft ordinance. Does anybody have any questions or discussion or
Questions for Brent?
anything else?
Tim?
Mr. Chair, so I was just kind of curious about cities within, Beltrami County. Have they expressed what their intentions are? Are they gonna assign to the county or are they gonna do?
Did you say cities?
Yes.
I've talked to a couple of them. I haven't talked to all of them. I'm still working on scheduling a date to invite cities and townships to a work session discussion group where we can just get together and talk about what the ramifications would be if they delegate authority, what it would look like if they didn't, what our ordinance includes and what they want to do. I assume, based on what I'm hearing out there, that most of the cities and townships are going to want to delegate authority to the county besides the city of Bemidji. I haven't talked to the city of Wilton, but they're one that typically likes to do their own thing. So I would assume they would do their own thing here too, but we'll reach out to them and talk to them all.
Thank you.
Anybody else? Yeah, Joe?
Yeah, I believe the city of Bemidji set their buffer for schools at either 500 or 750 feet.
Okay.
So would they be in violation of this ordinance? Do they have to redo it or are they fine because they're their own city jurisdiction? And they're doing their own permit, registration?
Yep, so I confirmed that this morning with our policy analyst at AMC. They're fine to do it on their own. They can have an ordinance that completely goes against what the county ordinance would have. As far as the number of registrations, the buffer requirements, the process for permitting, all of it. So yeah, they have their own authority to do that.
Greg?
Yeah, thanks, Mr. Chair. Just wanting, especially for Christina, who's here, the city administrator of Black Duck. I know they had talked about wanting to do kind of a partial delegation of authority, and I'm just wondering how that would fit, because I believe that the city of Bemidji is probably going to settle on authorizing up to 6 non-municipal establishments, which would essentially afford the county to be able to say no other ones are allowed anywhere else if they got their 6 before somebody or someplace like Black Duck did. And wondering how that partial delegation, if they have their own ordinance, but it doesn't have them doing everything, is that still able to afford them the ability to have one separate, just like the city of Bemidji can have more than the 4 that Beltrami County is allowing?
Yeah, my understanding is they wouldn't be able to partially delegate.
Okay.
After we've kind of talked about more and learned more, really they want to delegate the inspection part on the back end because
Right.
they don't have the staff and the people to do that and stuff. And we've just kind of talked about logistically that, you know, we could maybe charge for those services or something like that, but it would most likely be delegating or not delegating. And then if the city of Bemidji had their 6 and the county quota has been met before any other ones were outside the county, our ordinance says that we wouldn't issue a
Right.
registration to anymore. And so then I think at that point, the county board would have to consider either amending the ordinance to allow something, or maybe the people that are providing information and feedback to the commissioners says, we're good with that. We're fine with that.
Is there an opportunity for them if they do delegate and don't have their ordinance initially, can they change their mind and come up with an ordinance?
Yep.
Once so if they have a business that says, yeah, we want to do this and we're going to apply for our license and that then they could actually create an ordinance and then they would pull back that ability to have one at that time?
Yep.
Okay.
That's the way I understand it, is they'd be able to rescind their delegation to
Yep.
the county and adopt their own ordinance and implement their own rules at that time.
Okay.
Yep.
Thank you.
Richard?
Brent, it sounds like this ordinance is really going to have to be what they call a living ordinance, that there's going to be a lot of changes. It might be passed in one form January 1st, but it may look quite a bit different in a year's time.
Yeah, I would agree with that. I think that there is a likelihood that the administrative rulemaking process at the state level creates some circumstances where some things in our ordinance just are conflicting with state law at that point. And so we'll need to update it to comply with those rules or whatever they come up with. This is kind of the worst case scenario for rulemaking or ordinance making, I think, where you're forced into doing something fast without knowing all the answers. It's a situation where we're doing the best we can with good intentions, knowing that we're gonna probably revisit this and have the ability to do that. So there was a comment made at the planning commission level where, you know, it's easier to adopt a restrictive ordinance upfront and then pull back on some of those restrictions later than it is to adopt a bare bones ordinance and then add more restrictions. So that's kind of the tenor here. Yeah, I would agree with that I expect there will be changes.
Any other questions for Brent? Brent, good job. I know this hasn't been.
Thank you, Brent.
It's been a tough deal, so thank you. You did a great job.
Thank you.
Changing too.
Yeah.
Thank you.
So,
Like they said, summer of this coming year before they really have things, before they have things done, 6 months from, or more than 6 months from now. So,
and I
yeah,
would just remind the commissioners that the December 3rd public hearing is on the consent agenda. If you have any issues with that, we can make sure we pull it off, but otherwise it's on the consent agenda to have a public hearing on the 3rd. Yep.
and we pretty much need to do it then in order for us to be able to move forward and pass something before the first of the year.
Yeah. All right. Thanks, Brent.
You're welcome.
Now we can do one watershed, one plan.
Now we can do one watershed, one plan.
Come on up, Caitlin.
Well, I told Caitlin she should come down and be here because she's the one that helped this
Absolutely.
process over the last 6 months-ish to get it kind of to where it's at today. So if I don't know the answers to any technical questions or anything like that, she's my support here today. Kind of have a few different things going on tonight, just giving you some update on where we're at with the Upper Lower Red Lake One Watershed One Plan process. Just some background. This process began in 2022. It's a cooperative agreement with Beltrami County, Beltrami SWCD, the Red Lake Watershed District, and the Red Lake Nation. This is actually the first one in the state that I am aware of where a tribal nation has signed on as a policy committee member in forming a One Watershed One Plan. A lot of other tribal nations have been involved with them. They just haven't been formally on the policy committee. So we're breaking some ground here in the state of Minnesota. There's been many policy committee meetings, many advisory committee meetings, steering team meetings, a lot of work behind the scenes with Houston Engineering, our consultant, and for drafting and coordinating this process. The draft plan went out for review this summer to the agencies and the public and everything. There was a public hearing last month at Seven Clans Casino, end of October, up in Red Lake. The plan is about 180 pages long. I brought you a copy just to see. We won't go over this. I was gonna freak Tom out and tell him that since we're ahead of schedule, maybe we'll go through the plan, but we won't. So next steps. The next steps are to submit the plan to Bowser for approval, adopt it as our official water plan for that area of Beltrami County, and implement the plan. On your consent agenda today, there is a resolution that combines those three things. So if you pass the consent agenda with that on there, it essentially authorizes the county to submit this plan to Bowser for approval. Contingent upon Bowser's approval, then it adopts the plan and we begin implementation of it. The next thing, we have a memorandum of agreement that we've drafted. Caitlin's been working on that. This one's been a little bit more unique than some of the other memorandum of agreements around the state because we have a tribal nation involved. And so we've been working with our county attorney and the tribal attorneys on language that works and fits with everything. And so we have a memorandum of agreement, a resolution on the consent agenda as well tonight. And the memorandum of agreement essentially states that we're all going to work together to implement the plan. We're going to create a policy committee to make recommendations to the fiscal agent. The grant for implementation it's a large grant for implementation of these watershed plans, but the grant is really with a fiscal agent. The policy committee isn't like a joint powers entity or a joint powers board. It's not a legal entity. It's kind of an advisory group. All the local boards, the county board, the SBCD board, they all retain all of their own authority as boards. The policy committee members don't take any authority with them. They're essentially acting in good faith on behalf of their organizations and making recommendations to the fiscal agent on implementation and everything else. Beltrami SBCD was the fiscal agent for the plan, and we're assuming likely will be for the implementation as well. Caitlin was kind of our lead person for the plan process. And we've got another guy in our office, Dan, who likely would be the lead person for implementation if we're the ones that would be doing it. So since his primary workload is soil health and ag related stuff, and that's a good chunk of the main priorities of this plan is dealing with ag type stuff. And so it would make sense to have that person administering the plan up there as well. So I sent a summary of the plan in there. It was just kind of a brief, high level overview of the plan in the agenda bill, but that's all I have for you today. I just wanted to make you kind of aware of what the details were with those resolutions and what those really meant. And if you have any questions.
Craig?
Sure, yeah. Is this very similar to the Watershed One plan where it's all voluntary?
Yep.
The farmers, all the landowners and stuff are offered programs that can assist and help with the conservation and protection of our water and that, but it's not a heavy-handed
Yep.
situation where they're all of a sudden have a bunch of regulations on them, correct?
Yeah, it is exactly the same.
Okay.
It's all voluntary. There's no rules being created with this plan. It's essentially providing dollars to go out and implement these restoration or protection goals and be working with landowners who are volunteering to be a part of that. Usually, a lot of these, there are some financial incentives for landowners to do it, to participate in it, whether it might be like, it might be converting a traditional row crop to implementing cover crops or no-till drill into their operation. It might be a cattle a confinement area that would be looking at establishing some rotational grazing to better keep vegetation on the ground so that their cattle have better forage and less manure or sediment going into their creeks in the spring. Some of it is providing drinking water to cattle to get them out of the streams and providing for fencing to keep them out. Yeah, so there's a lot of incentives, but not mandatory.
The carrot versus the stick.
Exactly.
Yeah.
Yeah.
So just wanted people that might be listening to know that.
Thank you.
Yep.
Anyone else have questions for Brent? One last question, costs of the county, other than our staff time?
So the grant, in theory, pays for all the staff time for implementing and for all that stuff. What the grant doesn't cover, so we're not required to provide a match for these grants because, for the planning grants, because it's already assumed that like the county commissioner that goes to these policy committee meetings, those expenses aren't covered by the grant. So there are some expenses to the county, but by and large, it's all covered by the grant itself.
Great, thank you. Caitlin, great job. Thanks, Brad.
You did a great job with it.
Thanks, Brad.
Thank you.
Moving on to the classification and compensation study. Welcome, Ann Schrader.
Good afternoon. So myself, HR Director Ian Schrader, along with, we have some representatives from Baker Tilly, and then also County Administrator Tom Berry will kind of be going over the classification and compensation study that we have the results for. So just a quick overview. The purpose of the classification and compensation study was to develop a pay structure that will allow the county to maintain fair and equitable structure for employees. Most importantly, the study will follow or must follow federal and Minnesota pay equity laws for the local government pay equity. Some requirements of that and of a job evaluation system that meets those goals. The elements would be a structure that's kind of based upon the skill, effort, responsibilities, and working conditions of a position. This is done with Baker Tilly's safe point factor job evaluation system, which they will get into a little bit more here during their section of the presentation. We must also ensure the pay structure is one that is used to determine comparable work value for all classes of our employees in the organization and all the positions. So our last study was done over 10 years ago, and that was conducted by Springstead. And the implementation of that study was by using the next closest step when the results came through. For this study, the board approved the classification and compensation work group, and that consists of Commissioner Anderson, County Administrator Berry, Auditor Treasurer Treat, and then myself as HR Director. We developed different elements that we're going to go into the study itself, and then sent that out for an RFP for proposals to conduct the study. 4 RFPs came back, and with that, the work group reviewed and scored the RFPs individually, and then met as a team to kind of go over our evaluation, and then we selected the top 2 firms to bring in for an interview. From there, the recommendation was that we go with Baker Tilly, which the board approved. And just some highlights about Baker Tilly itself or themselves, they follow the best practice and guidelines to collect and analyze data for compensation and classification studies. The firm also specifically focuses on providing compensation consulting services to all sizes of local government. So one of their statistics about, the firm that we found out with the RFP process is they have done over 500 projects that are specifically, or with specifically 30 in the last year for Minnesota agencies. In the last 4 years, excuse me. The team of professionals that you'll be chatting with tonight, they have direct local government experience and also human resources experience as well. And they are certified compensation analysts. So today we have our consulting manager, Sarah, and our classification and compensation analyst, Thomas, and I will pass it over to them.
Thanks, Ann. All right, well, I do have a bit of a brief presentation for you all. Thank you so much for the opportunity to share our findings and recommendations for the classification and compensation study for Beltrami County. So taking a look at our full process, we want to be as transparent as we can with what we've done throughout this study. So we work through a 5-phase process with the county. I'll go through each of these phases, but letting you know that we're here now in the final phase of phase 5 of project completion. We're preparing the final report, handling all project documentation over for delivery, and then administering ongoing training with HR. So diving into the 5 phases, we start with project initiation, which is where we get to understand the needs in the working relationship with our project client team, understanding what needs are going on with the county right now. A very large data collection effort then went underway, understanding your existing pay structure, policy handbooks, job descriptions, organizational charts, any of the union and collective bargaining agreements we needed to know about, just how salary is administered in Beltrami County. We did do communication meetings, introducing ourselves to employees and leadership, letting them know about the study and have the opportunity to answer questions. The largest part of our data collection effort, though, does come from the position analysis questionnaire. So this is an online questionnaire. We had over 99% of the employees participating in the position analysis questionnaire process. It's an opportunity for the employees to tell us in their own words about the work that they're doing for the county. Those PAQs are then routed to a supervisor for review and had 99% of the positions represented in our PAQ process. This is really important because it formed the basis of the study. So all of our data and all of our analysis really stemmed from the participation of employees and their supervisors in this early phase process. From there, we moved into our phase 2, which is position review. We started by reviewing all 144 titles, making recommendations for adjustment. And as Ann stated, we then conducted our job evaluation system, which is a point factor tool. We call it SAFE. It stands for the Systematic Analysis and Factor Evaluation. It's a process that allows us to understand the hierarchy of jobs within the organization. It's a measurement of the position, not the person in the position. And it's measured based off of these 9 compensable factors. The typical ones like education and experience, not what the individual holds, but what the position requires. We also look at the level of work or complexity of the job, who they're interacting with on a regular basis, the physical demands, the working conditions, or those environmental exposures, whether the position has autonomy and discretion and independence to make decisions, what's the impact of those decisions on the organization, and the type and scope of supervision exercise. Again, because this is a measurement of the position, not the person in the position, we are in compliance with Federal Equal Pay and Minnesota Local Government Pay Equity Act. This is what's really forming the basis for understanding grade assignments later on. While we're out and understanding the internal equity of the organization, we're out to market. So in phase 3, we worked with the county to identify comparable and competitive peer organizations who look like you, work like you. We carry a significant threshold of the positions in the county to market. In this case, 75% of the positions were carried to market. Best practices say that we need to at least calculate market values for 50% of the positions. So we go out to market with at least 75, guaranteeing that we're going to get enough data to be able to make adjustments to the pay structure. And then we do make some adjustments to that data once it comes in. So something like work week, if another organization is on a 37.5-hour work week, we want to make sure that the annualized rates are the same. We age the data if it's not for the current fiscal year. Here, that only happened with the Bureau of Labor Statistics. But most importantly, we don't weight the data. This is a law of averages we're working on as we understand the positions. And so no one peer is given preference over another. No data is pulling the data in any given direction. It's a law of averages. And then we don't just do a title for title match. We actually dive into the duties and responsibilities to ensure a quality match as well. So the county identified these 12 public peer organizations to be included in the study. And then you can see our 3 published surveys. Those are Bureau of Labor Statistics, Comp Analyst, and the Economic Research Institute. Those are included to help represent the private sector in this data. Overwhelmingly, the majority is coming from those public organizations. But if we do have analogous positions, they're in competition for talent with the private sector, those are going to be incorporated as well. We're able to collect or compile data from 11 of those. Unfortunately, Bemidji area schools was not able to participate in our study at this time, but we were able to capture 14 points of data from the peer organizations as well as those private sector surveys. So in total, 110 benchmark positions were included in the survey. We're able to capture then market values for 94.5% of Beltrami County's benchmark positions. From there, we prepared a couple of different reports looking at comparisons of the salary ranges, ensuring that your minimums are going to be competitive, so you're able to draw talent into the organization. But we don't just look at the minimums, we look at midpoints, we look at maximums. We want to understand the full range. So Beltrami County is not just a training ground where you can come into the organization, train them up, but you're not competitive at the midpoint or the maximum, and you may be losing talent as retaining employees as well. So we look at the full range spread. We also look at different thresholds representing 5% above, 5% below of market. And then we did have an average of about 7 matches on average for each of the benchmark positions. The more matches we have, the more confident we are that this is the true market data for that position. So great market data here with 94.5% of the benchmark positions represented in market. And looking at that data that we are able to calculate market values for, based on the draft market results, on average, Beltrami County is 6.6% below market at the minimum, 12.4% below market at the midpoint, and 17.3% below market at the maximum. So what this is showing us right now is exactly that scenario. We're a bit more competitive at the minimum, but we are losing ground throughout the pay structure as we get approaching midpoint and even at the maximum. Right now, overall, this is showing a lagging market philosophy. This is likely just a function of it being 10 years since your last study, making incremental changes, kind of the results of COVID, everybody kind of catching up. And so this is a great opportunity for the county to really recalibrate your entire pay structure to be market competitive and make up some ground here. So once the market results are complete, then we start turning our attention towards pay plan development. We did make recommendations for adjustment with your existing pay plan, and it's going to help make sure that you're in compliance with Minnesota pay equity, but also that you have a great compensation philosophy and it's going to meet your business needs. So from there, we move into phase 4. Phase 4 is our pay plan development. Beltrami County currently has one pay plan, and we're recommending keeping that same one pay plan for all of the positions, but with some recalibration. We want to recalibrate this to market so you're market competitive, and it's also going to be tailored a little bit and really undergoing those compensation best practices. Once we had the pay structures developed, then we worked with the project team to review the proposed grade assignments. We worked with department directors, received feedback, made adjustments, and from there, then we were able to look at our implementation costing and provide recommendations as well. Phase 5 is again that project completion where we're working on the final report, the final presentation, and then being able to turn all documentation over for delivery, as well as ongoing training for HR and her team. So I want to walk you through kind of what we've done to the pay structure, why we've done it, as well as then getting into our recommendations. So this is familiar. This is your existing pay structure or your current pay plan for Beltrami County. It is a 10-step pay plan, meaning we have steps 1 through 10 and a minimum representing step 1 and the maximum representing step 10. It's 25 grades. However, not all of those grades are in use. You can see we do have those reds highlighted there for grade 2 and grades 22, 23, 24, where they're not all in use. That's likely just a function of supervisor subordinate separation or getting people up to speed pretty quickly into the pay structure. The majority of the positions right now are falling within grades 3 through 21. There's a couple of measures that we use to determine and understand the health of a current existing pay structure. The first is really that function of the number of steps and the percentage between steps. So on average, we have right now 3% between each step, though that is inconsistent. Sometimes it's 2.9, sometimes it's 3.1. Its average is about 3%, but it is inconsistent right now as we go from step 1 to 2 to 3 and up through step 10. On average, we do have then about a 30% range spread, that distance from minimum to maximum. If our range spreads are too narrow or we have too many steps, sometimes that does make a function of our minimums not competitive or even losing ground at the maximums. And so we want to make sure that we're really looking and understanding how to recalibrate this to market. Another important statistic that we use is what we call the midpoint differential. That's the distance between each grade at the midpoint. Right now you have a 10-step pay plan, which means there's not really a clear midpoint. Midpoint right now is mathematically somewhere between 5 and 6. Ideally, what we like to see is an odd step pay plan, so that midpoint is very clear. By the time you're fully proficient in the role, you should be paid at or near the market value for your position. Midpoint meaning market is our common terminology there. But we also want to make sure that your minimums are competitive. So your starting midpoint right now is at $19.99 an hour. You can see that's somewhere between that grade 1, step 5, and 6. And so what we're looking at and what we're proposing is keeping the same structure with some adjustments. So we are keeping the same 25 grades. We are looking at using more of those grades now, though. And then we do have, instead of a 10-step pay plan, we have a 9-step pay plan. So that mathematical midpoint, or it is very clear, it is aligned at step 5 now, is we very clearly understands how somebody comes in to the pay structure at step 1 and moves up through step 5 representing when they should be at or near the midpoint of their pay structure aligned to market. And so this step 5 is aligned to the market at the midpoints at about 95%. Our goal here is, because the results of market showed that we are about more than 10% behind market at the midpoints, we have a significant amount of ground to make up. By strategically lagging the market in the short term, the county is going to have the opportunity to really recalibrate this entire pay structure, really get it aligned to internal equity, make sure you're in compliance with Minnesota pay equity standards. Now that everybody is where they should be within the pay structure and all the positions are calibrated, now everybody moves equitably together, and in subsequent years, you can close that ground or make up that difference from going from a 95% of lag market to catching up to being 100% of market. So this is meant to be a strategic lag in the short term. But we have then looked at those differences between steps. Now, instead of that inconsistency, it's a consistent 3% between each step for grades 1 through 12. 3.25% between steps for the grades 13 through 24. The purpose there is we just need a little bit more wider range spreads for the positions at the top end of the pay structure. You can think that these are department heads, leadership, managerial positions. And so we want to make sure that they have enough earning potential, but also making sure that they're competitive in market with the market rates for those positions. We've expanded the midpoint differential. Again, that difference between each grade at the midpoint. We've expanded that because we do have a mix of all of the positions in one pay plan. So we have a mix of positions that are eligible for overtime, non-exempt positions, and positions that are exempt and not earning overtime. And as employees move through their career progression, sometimes they get very stagnant at that transition between a non-exempt and exempt pay plan, because they're looking at that next rung on the ladder and saying, I'm really comfortable. I don't have to earn any more because I'm going to out-earn my supervisor. And so by having more separation here between the grades, it allows us to be market competitive, but it also has that avoiding compression and making sure that we do have good distance between supervisors and subordinates here. Now, these numbers were not just picked out of a hat. They're not picked out of random. I'm going to tell you there's a little bit more math behind it. I'm a giant data nerd, so I'll talk to you about a good regression analysis all day long. But I'll keep it short and sweet, which is this is really what we use to then figure out how to tailor that pay structure to the new market conditions. So we want to make sure that we're in alignment, that your minimums are competitive, the number of steps makes sense, and that career progression works as well. So each one of these blue dots represents a position in the organization where we have the job evaluation scores and the market data where they intersect. And then the dark blue line in the middle is that line of best fit. The dotted lines then represent the pay plan that we have designed and proposed that are really falling in alignment and parallel to that market data. This is what's really helpful in understanding how we make those structural adjustments to the pay structure, but this does not tell us where the position should go on the pay structure. So this is about the structure itself. The next part of this process is, now that we have the pay structure and the values aligned, where do the positions go? So that's what we call grade assignments. So in Minnesota, because of this Minnesota Local Government Pay Equity Act, grade assignments are purely based off of the job evaluation scores. We use the PAQs, or those position analysis questionnaires, from employees and their supervisors to score the positions. That's what we use to then make determinations for grade assignments. In total, 142 unique positions were classified to a grade in the proposed pay plan, purely based on internal equity. We don't consider, again, the person in the role, their performance, how long they've been with the county, even their existing salary. This is about the value of the position, not the person in the role. That's what allows us to be in compliance with that pay equity. That's what pay equity is. So then once we have those grade assignments determined, we did review those with the project team. HR facilitated conversations with directors to ensure that we were evaluating the positions correctly, got their feedback and needed to make any adjustments or changes to reevaluate the positions, again, using those PAQs as the basis, and then feedback from directors. That's what we use to then determine those grade assignments. From there, we then move into our implementation scenarios. So up until this point in the study, I haven't considered the people in the role at all, about what the structure looks like and the positions itself. Now here, once we figure out how much is this going to cost Beltrami County to implement our recommendations, we start plugging people back into the equation. So the calculations that we're about to show you reflect base pay only. So these do not include anything like supplemental pay practices, shift differentials, overtime, or even our benefits and those kinds of components. So this is purely reflecting base pay adjustments only. Important to note that Baker Tilly does not recommend a pay decrease for any employee as a result of a study. In the case that we do have a handful of employees where their current salary is above or outside of the new proposed range, we do not take money away from them to put them onto the pay structure or find them an appropriate step. If there are a handful of employees that are above the new maximum, we consider and make recommendations to red circle or freeze those employees until the pay structure shifts and market conditions catches up to where they are. Again, that strategic lag in the short term, by the time we're leading market, they will likely be folded back into the conversation. So we prepared 4 different implementation scenarios for the county to consider. The previous implementation of your previous study was option 1. This is where employees, based off of their current existing salary, move to the closest step without a decrease. This is just to get all employees onto the pay structure. Option 2 is actually where we move employees to the step that corresponds to their years in position. So they may have been with the county for 15 years, but last year they've made manager. And so we want to move them to the appropriate step within that manager pay range. So if a position or a person in a position has been in their role for 3 years, they would move to step 3. The math there is then taking the minimum of that salary range and then determining 3% for each of the 3 years. And that was what we determined is that adjustment to their existing salary. So 3 years in the position, step 3. Option 3 is the move to the same step. So ease of administration, ease for employees to understand whatever your current step is currently is what you'll be on within the new existing pay plan. If employees are at step 10, because we're going to a 9-step pay plan, they would be on step 9, unless that would result in a decrease of their salary, in which case they're red circled or frozen. Option 4 is employees move to the next step from the closest step, which means this is the same option as option 1, but then we give everybody an additional step. This is helpful as a calculation that can predict how employees are moving through the pay structure and what it may look like next year if everybody achieves a step. So those are those implementation scenarios. Again, then we worked to understand where the 451 employees of Beltrami County are currently within those and prepared the recommendations and the calculations. So based off of our snapshot results of the payroll at the time, and we have employees that are below the minimum are at 155 employees that have a current salary that is below the new proposed minimum. So option 1 is just trying to get them to the closest step without that decrease. 291 employees have a salary that is within range within their new 9 steps. And then we do have 5 employees that are above the maximum. Again, you can see for each of the scenarios, their salaries are not adjusted and there are no additional calculations for those employees. Those are our red circle. So I'm happy to answer any questions, but I do want to end with our recommendations, which is really urging Beltrami County to approve the pay plan and the position grade assignments that were in compliance with Minnesota Local Government Pay Equity Act based off of the job evaluation scores reviewed by the project team with feedback from department heads and leadership. And then approve an implementation scenario that addresses the county's compensation philosophy, business goals, one that is fiscally sustainable. Our goal was to not just to deliver a pay structure that works for this year, but one that will allow you to maintain over the life course of the pay structure. And our biggest recommendation is just to continue efforts like these, maintain the classification and compensation system by routinely reviewing positions, job descriptions, market conditions, adjusting the pay structure and salaries annually to keep pace with market, and even adopting general increases annually to reward employees and ensure that there is this advancement through the assigned pay ranges. This is the project team, and I'm happy to answer any questions anyone has about our process.
Questions? Doesn't look like we have any questions, Sarah. That was a great run through.
You guys don't want to talk about a good regression analysis all day? I'll do that all day.
Mr. Chair, I just wanted to follow up on Sarah's presentation and talk with you about the committee's discussion and recommendation regarding the 4 implementation options that's been presented. Sarah and Thomas will remain on the line in case you have specific questions as it relates to implementation options and kind of what we'll be discussing next. But after carefully reviewing those 4 implementation options that were presented by Baker Tilly, the Classification and Compensation Committee looked at those options as well as the county's finances and is making the recommendation that the board adopt option 3 and to also include a 1% additional market adjustment above the 2% cost of living adjustment that's already been established for 2025. What this would do is it would essentially not only keep employees whole with regard to the implementation of the study, but it would also make sure that we don't start behind by implementing the 2024 market assessment results in 2025. So we talked with Baker Tilly, our HR directors talked with others to try to figure out how could we take the 2024 data and ensure that because we're likely to implement in 2025, should the board approve this, we just don't want to be behind. So what would we need to do to the 2024 data to get it to be 2025 data? And the conclusion was it would need to be adjusted. The entire pay structure would need to be adjusted by across the board 3% increase. The good news is 2% is already established and budgeted for next year as part of negotiations. So that's the reason for the additional 1% recommendation by the committee. Thanks to the wisdom of the board for saving for this project and planning for this project, the money that we have budgeted for this project will pay for the project. So you already have this money budgeted right now. It was very close. I mean, we were very close on the estimates, but the money is there. So I wanted you to be aware of that. I did also want to give you thanks and also let you know that your additional wisdom and forethought during union negotiations is one of the biggest reasons why this number isn't in the double digits. You might recall there was a mid-year adjustment that was made to market of 4%, which is something the county hadn't really ever done, at least in recent history. Had that not occurred, these numbers would be 4 to 5% higher than they are currently, and that would simply have been unaffordable. So the reason the numbers are smaller than maybe we anticipated in going into this is because, especially as of late, the county has done a really nice job trying to keep pace as much as we could within the means and the data that we had available to us in keeping the staff whole. So I just wanted to mention that. In regards to next steps, if the board does consider approving this plan, and it is on the regular agenda for your consideration this evening, the plan would be to implement it for all non-union staff members in the pay period that includes January 1, 2025. We just need time internally to process these results, do all the PADs for over 400 employees, and get the calculations right and proofed, and then give that information all over to payroll to then enter and so on and so forth. The implementation for union members will likely follow a different path. We want it to follow a similar path, but because we have union contracts, we have to follow, we can't just implement. So we have to meet with the unions. One of the things is that the recommendations that we're being made tonight are outside of established union contract implementation language for a classification compensation study update. So because of that, we're likely to have to enter into what is called a memorandum of agreement with each of the unions. And so we'll need to sit with those unions, share with this information, meet with the business agent, the representatives, and then through a memorandum of agreement rather, attempt to implement the same way we're trying to implement for the non-union staff. We want, our intention here is to keep everybody the same, keep everybody whole. We just have to follow a different process, as you might imagine, because we have union contracts in place. So that's the intention. If the board does approve this study, we would like to inform the staff as soon as we can. I mean, I can guarantee you, if you approve this tonight, our phone will be ringing off the hooks tomorrow morning. And everybody's going to want to know where they're at. Where's my grade? Where's my step? How much am I making? Am I losing money? Am I whatever? You know, and of course, the recommendation we have is that nobody's losing money. But we are going to get these questions. And maybe this is directed to the staff more than anybody else. We're going to need a little bit of time to parse out this data. I mean, this is one comprehensive study. And in order for us to get everybody's individual data out, we might need a couple days to do that. So I would ask the staff to be a bit patient with us while we attempt to do that. We want to get you the information as soon as possible, provided the board approves it. So that's our intention. Lastly, I just want to say a project of this size and nature comes along fairly infrequently. I mean, as you've heard before, it's been 10, 11 years or so since we've done a project like this. It's an expensive project. It takes a lot of time. It's somewhat distressing for the staff going into a project like this and not knowing what the results are going to be. It's difficult on leadership as well. It's certainly yourselves. You know, how are we going to be able to afford whatever the number is going to be? All of that's very distressing. So I just want to maybe throw a couple of shout outs to some folks. First of all, I want to start with the board. For your absolute and unwavering support of the staff. Right from the very beginning discussions, which really started during union negotiations several years ago, this board was clear about its support for the staff. And I'm so grateful to be working with a board that cares so deeply about our county workforce. So thank you for that. If it wasn't for your wisdom and forethought and your planning and your saving years ago, we would not see this project come to fruition today. So thank you very, very much for your leadership. I also want to thank the committee because all of us have jobs. All of us who are on the committee have jobs. We got lots of other things going on. This is an enormous amount of work. It takes a lot of time. And we're talking about colleagues and we're talking about impacts to the county and we're trying to balance all sorts of different things like finances and operations and impacts and union implications and staff and all of this kind of stuff. And it's trying, it's hard. And I want to thank the committee for its professionalism and for always putting the interests of the staff and the county first and foremost. So that has been very, very rewarding for me, at least, to be a part of a group like that. I want to thank Baker Tilly. As you see, I think we hired the right team. We had a team of experts on this project right from the very beginning that is incredibly knowledgeable. I've been through a couple of these studies before. The command by which Baker Tilly took this project on and the way that they have been able to help the committee and the county along the way, and the professionalism and tenacity and patience they had with us along the way has just been absolutely, immeasurable. It's been very, very impressive. And I'm very, very grateful to Sarah, to Thomas, and the leadership team at Baker Tilly for helping us through this. They've ensured that this is the most fair and objective way that we can approach this study. And I'm very, very proud to have them as part of the project. I also want to make a shout out really quickly to the management team. They were instrumental in helping us along the way too. The department heads had to look at their structures. They had to look at the internal arrangement of their structures and help us evaluate the equity and organization of their structures. They provided that feedback. We had conversations with them. That was integrated into the process. And of course, that takes time for department heads, particularly those who have large departments, to go through that process. So I'm extraordinarily grateful for them, for their feedback and support and their contribution. And lastly, I want to thank the staff. It might not seem that the staff has done very much, but they're the basis of all of this, right? We're working so hard to try to do what's right for our staff. And this project started at the very beginning with the staff, willingly contributing to the process by developing their PAQs or their personnel action or personnel, their position analysis questionnaire. We have so many acronyms on this.
I was gonna say, there you go, you got it.
Yes, thank you. But also, I just want to thank the staff for their trust in the process, right? We've worked as hard as we can to try to produce the best result that we can. We know that for some people, it may not be the result they're hoping for. But I can guarantee you that it's the best that we could do with the objectivity and the alignment with the state and federal statutes that's required for this type of work. And I'm just very proud of it, and I'm grateful for the staff's patience. We'll try to get you your results as soon as possible, should the board favorably act on this evening. But that's all I have for you this afternoon. Our HR director, Ann Baker Tilly, and myself will stand for any questions that you might have. As a reminder, this is on the regular session for your consideration. It's not on consent in the event that you decide you want to have additional discussion at that point in time as well.
Questions for Tom or for Baker Tilly? Nope. I think we're good.
All right, excellent.
Great presentation. Thank you. Thank you,
Thank
Baker
you.
Tilly.
Thank
And
you, Chairman
Schrader, thank
Thomas.
you.
We appreciate it. I guess I'll just stand here for the next item if that's all right. All right.
Moving on to administrators update.
Right. Thank you, Mr. Chair. I have a very brief update. It's only been a week since we've met, so, you know, although that's a little bit of time, I don't have a whole lot for you. I just was going to update with you on our second meeting with Health and Human Services leadership team. We did meet for another 2.5 hours, the budget committee and leaders of Health and Human Services, to go through the remaining half of their presentation. As you know, we've been working through trying to get a better understanding of the Health and Human Services budget, the constraints and challenges, and the opportunities available within that budget and within process improvements to make a better outcome, you know, next time as we go through the budget process. It was, as I said before, it was extraordinarily enlightening. It was very informative. It is something I think the board would benefit greatly from hearing. We probably should have tape recorded it now that I think about it, because then you could have just watched it on your own. But I do know Ann Linseth, our Health and Human Services Director, would absolutely love the opportunity to answer any questions or talk more with any of you about what they're doing, because they're actually doing some pretty darn cool things. In fact, a lot of the things that they've adopted on their own are in parallel with high performance organizations. So it's very exciting for me to watch the evolution of that group, and I'm excited to see what's next. I think we're going to see some really great things from that work group, and sometimes that's all it takes. It takes a challenge for us to then seize an opportunity to transform what we do, and I'm absolutely convinced that they're on a great path. So I just wanted to give a vote of confidence there for that. And then I want to let you know, I am currently finalizing the county's 2025 legislative platform. I think we've got about 8 items on that list so far. Just another plug to you all. If you have anything that you would like for us to include on that, we'll be happy to include those. My plan is to present that to you for your initial consideration at the December 3rd meeting. Lastly, Diane, if you have those handouts, this will be great. I just wanted to mention that it's getting close to the time frame where we have to do all that end of the year minutia, you know, things like committee assignments, per diem stuff, newspaper, blah, 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 all that stuff. And so in anticipation of some of those conversations in December, I wanted to pass out the current committee list for committee assignments. So you all want to kind of just look at that, maybe talk amongst yourself about what committees you want to remain on, what committees you may want to change. We're also going to give that list to Commissioner-elect Winger so that he can also participate in that process somewhat informally, because really, you know, you all still get to make the decisions, but at least he can maybe provide us some insights about what his interests are, what committees he might want to be on and that kind of thing. And then we can get you that information, and then you all can deliberate on that. Nothing's required right now. We've got several weeks before we're going to bring this up for discussion, but it's just something we wanted to kind of get you prepared for. Lastly, just kind of a fun thing. I wanted to give you a reminder that we're going to have the United Way Chili Cook-Off and the basket raffle. It'll be on Wednesday, December the 4th. It'll be in this room from 11:30 to 1:30. A great deal of competition, a lot of fun, a great way to mingle with the staff, and I know they would love to see our county board members there. So no pressure, but you are certainly welcome and invited to attend. And if you'd like to participate, we can put you in touch with somebody who can help you with that too. That's all I have for you this evening. I'll stand for any questions you might have.
Any questions for Tom? With that, I did communicate with the other commission members about doing what we did last year. We all kicked in $20 and Diane was gracious enough to take our $100 and get a really great gift basket. I'm not sure who won it, but I know that they really liked it. And so I'm inviting all the commissioners to kick in $20 so that we can have a basket from the commissioners. So
Thank you very much. Appreciate it.
thank you.
Give that to Diane.
Yeah, we'll give it to Diane. And with that, any other business, at this time, where are we at?
Any changes, anything want to be pulled from the consent agenda? So now will be the time.
That's good. All good on the agendas? Okay. All right. We're adjourned until 5 o'clock.